There's so much to be said and told these days about the COVID treatments. Joining me today is Dr. Eri France, the Chief Medical Officer at CDPHE. Doctor, it's always such a pleasure having you with me.
And for me to be here. Thank you so much.
So, Doctor, what are the current treatments for COVID?
Well, the good news is there are many treatments for COVID. And that means that if you test positive or have symptoms, the first idea in your head should be, what about treatments? Where do I get them? And I should go check on that. The treatments are of two broad types. Some are a pill that you take by mouth, and those are antivirus medicines that when you take them into your body, it stops the virus from growing. And the second one, a group, are given in an IV, and that's a boost of antibodies that fight the virus. And so if you have these antibodies on board, they bind and attach to the virus, and from there will then keep the virus from growing.
Okay. And how many treatments do we have right now? There are three, if I'm not wrong, correct?
There are 3 antivirus medicines that are available, 2 that you take as a pill and 1 that's an IV. And then there are also 2 of the antibody treatments as well.
Who is eligible to receive them? Do you find that there's still some misconception when it comes to who had the right to receive them and who doesn't?
I do think there is a misconception. I think the number of people who are eligible is actually quite high. And you will only know if you speak with a provider, a doctor, a nurse, a pharmacist, to see if you are eligible. For example, if you are overweight, and almost 2 of every 3 people in Colorado are overweight, you are eligible for the medicine if you are overweight. If you are age 60 and over, you are eligible. If you have asthma or diabetes, you are eligible. So many people are eligible, and many today think, well, I'm probably not one who would qualify for the treatment, and it's not true. And of course, the good news about the treatment is that it reduces your chances of being hospitalized by almost 90%, specifically for the medicine called Paxlovid. Paxlovid is a pill that you take twice a day for 5 days, and you need to start it within 5 days of your positive test or your symptoms. And if you do take it, again, it reduces the chances of you being in the hospital by 90%. And today, I think for COVID, my focus is and remains to keep people from having serious disease and from being hospitalized. So being vaccinated and taking a treatment as soon as you test positive is the best way to do that.
Doctor, let's say I test positive. How do I determine if I'm a good candidate after checking mentally all the characteristics you just mentioned? How do I determine, yes, I should check with my medical professionals if I'm eligible to get this prescribed or not? I think I can manage the symptom at home. How do I weight that?
Well, you can certainly start by looking at our website at covid19.colorado.gov and learn about these treatments. And we have information there about who is eligible. Of course, you can also contact your doctor or your nurse if you have a regular provider, maybe by phone, or send them an email, or find out what they would recommend.
Good. Do they have any side effects? Maybe some folks are listening to that, and as they were concerned with the side effects of the messenger vaccines, now they may feel like, okay, how about this antibodies treatment?
Well, I think most medicines can have a side effect. So whether you take an antibiotic, maybe it causes you to have an upset stomach or some diarrhea, or maybe you have a rash from the antibiotic, that's common. And so these medicines too can have side effects. They can make you feel nauseated, you might have diarrhea, you might feel dizzy, but that's rare, it's not common. There's also certain medications that if you take, you don't qualify for all of the treatments. And so it's important to speak to your doctor or a healthcare provider about any medicines you're on any other medical conditions you have. If you have kidney disease, if you have liver disease, that can affect how your body responds to the medicine. And it's important to know that before the medicine is prescribed.
Great. I want to take you to another topic, and I want to take you to Evo Shield. What is Evo Shield? And I want to make sure that we emphasize that this is not to be confused with the treatments for COVID, correct?
That's right. Evo Shield is a long-acting antibody. It is a medicine that if you have moderate to severe immune compromising conditions, that you would get a shot of Evo Shield, and it protects you from getting sick in the coming 6 months. And so it's more of a prevention rather than a treatment. And people who have cancer or other immune issues that mean they don't respond as well to the vaccine, we recommend that they not only be vaccinated, but get Evo Shield as well. And it used to be that when you would travel to different countries, you might get a shot of immune globulin to protect you from getting vomiting or diarrhea in these other countries. And Evo Shield works the same way. It's a dose of antibodies that is slowly released over your body and stays active for a 6-month period. And so during that 6 months, if you are exposed to a COVID virus, Evo Shield will bind to it and stop it from growing. So it's a prevention medicine rather than a treatment medicine.
Terrific. Speaking of prevention methods, I understand Novavax is hitting Colorado pretty soon?
Yes, that's right. Novavax is here. It's another option for vaccines. And it's a good vaccine. It is made in a way that is more like our traditional vaccines. When we created our first vaccines for COVID, it was using a modern new way of messenger RNA or mRNA vaccines. And some people wondered, is that okay? Is it safe? I don't want this new mRNA vaccine. Now, Novavax is a vaccine that's made just like all the others that we've been making for over 100 years. And so persons who were hesitant with an mRNA vaccine might be open to receiving the Novavax vaccine instead. I don't think that it's better than the mRNA vaccines. We don't need to go out and get special boosters with Novavax. If you've been vaccinated, you're good. If you haven't, please consider vaccination and know that Novavax is a new option for you.
Doctor, last question. Do you have any forecast for the upcoming fall season when it comes to, it's the flu season, we have still Omicron, BA.5 among us. Do you have any concerns or any word of advice that you'd like to give to the ones who are watching you right now?
Well, I think that in general, we are slowly passing around the Omicron BA.5, and it's actually coming down at this point because many people have been ill with the BA.5 over the last 4 months. And pretty soon there won't be a lot of people left to get sick. And so September and October, I expect the cases to continue to come down. What we'll always be watching for is some new variant that might start up in another part of the world that might start coming up. And we really haven't found one that looks worrisome in that regard. But assuming a new variant does occur, it might be December, January before we see those numbers come up here. So in the short term, I think we're good, but I would expect other variants to come through during the winter months.
Okay. Doctor, it's always such a pleasure seeing you and talking to you.
Thank you. It's great to see you as well. Thanks for the time.
Thank you.